Another really key component under staff development in a trauma-informed organization is around supervision and support. And oftentimes when I do trainings, I'll ask people about supervision and how many people get supervision, and I'll see a lot of hands raised, but when I ask more prompting questions like, is it on a regular basis? Is it uninterrupted? A lot of the hands go down, and people really, I think, struggle to get ongoing supervision and support in ways that really meet their needs. And this is really difficult work. And I think supervision is a really key part of the process. Because for a lot of us who are doing this trauma work, it's very wearing and potentially very triggering for us. And so a key piece of being able to do your work well is to have a certain level of awareness about your own stress levels, about your own triggers, about what sets you off, about what you need. And supervision is really a place to practice getting in touch with what you need professionally and sometimes what you need personally. So examples of ways to provide ongoing supervision and support in a trauma-informed context are some of the things that are in the organizational self-assessment as ideas are things like topics related to trauma are addressed in team meetings, that staff members receive individual supervision from a supervisor who understands trauma as well and understands the impact of trauma on both consumers that you're working with and staff. That an agency provides opportunities for staff to have input into program practices the same way we talk about wanting consumers to have input into their treatment, into where they live, into where they access services. Staff at those organizations also need to have opportunities for input. Another strategy from this self-assessment is that the agency helps staff debrief after a crisis. I think there are a lot of really stressful and sometimes overwhelming situations that we face in this type of work. And sometimes, I found when I worked in residential settings, there was sort of an understanding that if you really kind of needed to process something or something really bothered you, that somehow you weren't kind of strong enough to handle the work. And I think there's a real sense that having a way to debrief and having options and opportunities for staff to kind of process those things, I actually think helps prevent some of the more significant issues of burnout and vicarious trauma, which we're going to talk about in just a couple minutes. So another strategy around supervision and support is the idea that the supervisory relationship really tries to mirror the principles of trauma-informed care that you're exercising in your relationship with the consumers you serve. So I want to spend just a moment talking about self-care because I think that's a really key piece of providing trauma-informed care and being a trauma-informed organization. And we really talk about self-care as the responsibility of not just the individual, but also team members, supervisors, and leadership of an organization. And the reason that self-care is so important, besides it being important for everybody in any job, is that particularly when people are working with trauma survivors and trauma survivors who have witnessed a lot of really overwhelming things and had a lot of really difficult life experiences, is that for the people working with those families or with those individuals or with those adults or with those children, witnessing and holding a lot of those traumatic experiences can be traumatizing in and of itself. And there isn't enough focus, I think, paid a lot of times on the impact that doing trauma work can have on the service provider. And there are a couple different kind of definitions for this phenomenon. So one is that you're seeing is compassion fatigue. And the other is vicarious trauma, and they essentially mean the same thing. And they're basically talking about, the first being a state of tension or preoccupation with the trauma of the people you serve. And in the vicarious trauma definition, really sort of a transformation or a change in a negative way in your own inner experience as a result of empathic engagement with traumatized clients. And this kind of trauma can really go sort of beyond fatigue and burnout and have an impact on people, not just professionally, but personally as well, really kind of taking that work home with you, taking your concerns home with you in ways that start to impact people's lives in negative ways. So having an eye out for that and having a priority around self-care for staff becomes a really key piece of being trauma-informed. Some of the workplace risk factors for vicarious trauma include just working directly with people in need, which I'm sure is all of you at this conference, hearing distressing stories, witnessing distressing events, being or feeling responsible for people but not having the resources to do your job well, which I think unfortunately happens a lot in this work, moving from one challenging situation to the next without time to process or debrief like we were talking about, a lack of communication within an organization, not having adequate time off or overworked staff, and in general, agencies that lack a supportive culture and an acknowledgement that this work is difficult. So, I would encourage you to think about what role what does your organizational self-care look like in your agency? And a couple strategies around that are things like integrating self-care topics into supervision and team meetings, promoting self-awareness among staff, encouraging staff to take their lunch breaks and their vacation time, providing opportunities for staff development, monitoring communication and signs of stress within the organization are small ways that you can kind of begin to put that on your radar screen. The next area of programming that I want to talk about is atmosphere and environment. One of the first steps in any type of recovery is to establish a sense of safety. So when you're thinking about both your physical and your emotional space within your agency or organization, I'm really asking you to kind of think about that with an eye for safety and how to help people feel safe. We've talked about this already, and I'm sure you've talked about this as well, but we know that triggers are reminders of past traumatic experiences. And we know that these are kind of become wired in our brains. So when we're faced with a reminder of a past traumatic experience, it sets off this alarm in our brains. And what happens next is our kind of thinking part of our brain shuts down and allows that alarm system to kind of be activated and take over. And the body goes into sort of fight, flight, freeze, survival mode. As service providers, we need to really be aware that those triggers or those reminders of past traumatic experiences set off an actual physiological response that people have that leaves them feeling helpless, fearful, and out of control as if they're back in the same traumatic situation they were coming from. So examples of triggers might be things like being yelled at or physically touched, feeling overwhelmed or talked down to in a meeting, not knowing what's happening next, doctor exams, having no voice in your own treatment or treatment plan, in residential or homeless service settings, things like unannounced room or apartment checks, or just feeling misunderstood or rejected. So a key piece of creating a trauma-informed environment is that they're designed to reduce re-traumatizing experiences and triggers that might set off this alarm response. So I again sort of encourage you to think about what some of the possible triggers or triggering practices could be for the people that you serve, and ask yourself the question: can some of these triggers be reduced? Can some of them be eliminated? If not, how can we be more aware of them and talk to people about them in a more direct way? So some examples of components of a safe and welcoming physical environment from the organizational self-assessment are things like having locks on doors, asking people if you need to check on their spaces, what's the least intrusive way to do that, having things like designated quiet rooms or spaces for people to go to if they're feeling overwhelmed, just creating a calming atmosphere, whether that's with plants or color or lamps or different types of light, reflecting the talents and cultures of the people you work with through different types of artwork, for example, having child-friendly spaces if you're serving children, and just in general a focus on even how you initially welcome people into your organization. Another huge piece of trauma-informed care is how to establish a supportive environment. So an environment that feels safe emotionally. And that includes environments really thinking about in your organization how to be as consistent and predictable as possible in when you have your meetings and when you set up your appointments, in setting expectations, in what kind of information you share and how transparent you are about sharing it. Open and respectful communication, how you speak to people, the tone of voice you use, what kind of language you use, what kind of labels you use, in front of them or behind the scenes to talk about them. And then I want to talk just a little bit more about privacy and confidentiality, safety and crisis planning, and cultural awareness as part of establishing a supportive environment in a trauma-informed organization. So just some strategies around privacy and confidentiality. Taking away people's kind of privacy is a lot about taking away people's control, which is re-traumatizing and really mimics past traumatic experiences. So, here are some examples of ways to be transparent and share information with people, explain the limits of confidentiality, kind of to discourage secret keeping or withholding information from people. Even things like being aware of where we talk about cases, making sure that we're in a private spot when we're taking a cell phone call, or really thinking about if we're in the hallway talking about a family, can another family hear us? Those kinds of things are small ways that we can really kind of keep privacy and confidentiality in mind. When we think about a shift to trauma-informed care versus more traditional approaches, one of the distinctions we sometimes make is a more traditional approach. It's very easy to be very reactive and crisis-driven. And part of a shift to a trauma-informed approach is an attempt to be proactive and try to avoid future crises ahead of time. So one of the things we know about crisis, and I'm sure you all experience the people you serve being in crisis, is that in that moment, people feel very out of control of their emotions and even just of their bodies. And that's really a time where how we intervene and what we say and what we do can either potentially escalate or re-traumatize someone or calm the situation down. So one of the things that we have in the organizational toolkit that I was referring to are some templates for sample safety plans and self-care plans. And we really encourage organizations to sit down and have everyone they serve have, for example, a self-care plan that includes information on, for example, what sets people off? How do they know when they're upset or overwhelmed? In those moments, what helps and what doesn't help? And who can people go to for support? So the more proactive we are up front with people around potential crises, the more we might be able to use those opportunities for growth as opposed to sort of barriers or real steps back in someone's treatment. Also, I wanted to speak a little bit about cultural awareness and just the idea that I'm putting on the screen some strategies to really think about when you're thinking about how to integrate culture and cultural awareness into the work that you do on a daily basis. And that includes how you set up your physical space, what kind of tools you use, screening books, movies, and media resources for kind of negative stereotypes, paying attention to your own biases and the biases of others, trying to understand the role that stigma plays regarding mental health issues and culture, and what we would call continuing to make a commitment to enhance your cultural intelligence, sort of your awareness about how culture plays into sort of all that we do and how we see the world.